Nice to see you, and welcome to this session, this dialogue. We call it dialogue. I introduce myself first. My name is Alicia Garcia Madrid. I'm working at Action Against Hunger in the Social Action Department, and me together with Irene and Julen will accompany you in the during the day, during this session. I mean, only a few hours of your day. Okay, so, we are leading, as you know, the European Network of Innovation for Inclusion, and this is like one of the first actions we are organizing with the members with the new approach of scaling social innovation. We would like to give a new perspective, a new view of the activities of the network, and we would like to support you in to take advantage of the innovations that we already have, all of us, we already have in our organizations, and support you with the scalability of them, and to acquire also social innovation from other organizations. So we are learning together, and we are promoting a peer learning and peer review at the same time. Okay, so the goal of this session is like, let me advance a little bit. This is like the first step of a lot of steps to guide you and to teach you or train you along the scaling up process of social innovations. So in this session, we will focus on two main goals. One of them is like to explore what are your feelings, or what are your situation, or what are your knowledge or feelings, I mean, around the scalability of social innovations, and what is your interest on this, and so we can fine-tune our interventions and our activities in the network. And second, we would like also to hear you about the challenge we are proposing for this year and a half, more or less, to work on, which is the inclusion of healthy approach in our employability programs. So we will have some examples, or we will have some inspiration, and we will explore together with you the interest and the possibilities of these challenges to be worked with you, okay? So with these two main goals, first, we are going to explore together with Irene who we are here, more or less, with information taken from the registration form. And then we are going to explore what we'll be doing during these 2 hours with you, with Julen. So I introduce first Irene. Irene, you may know her. Irene is working in the European Network of Innovation for Inclusion very happily, is the main face and the main person you will meet after the addressing or writing to the email address of the network. So I introduce you, Irene, and first we are going to speak about I introduce you, Julen, as well. Mm-hmm. And we are going to review the plan of the session first. I see in the slides is the coming slide. So Julen is our colleague supporting us in this process of the scalability. He's a good expert and a very experienced expert on social innovation and in this process as well. So he is also part of the team. So I give you the the floor, the online floor. Julian, first to explain which is the plan of the session. Okay.
Very good. Thanks a lot, Alicia, and thanks everybody. Good morning. Thanks for being with us. And I suppose that to say that I have a lot of experience is to call me very old.
No,
that is true. Yeah. I was playing. So the plan of today is to have a dialogue, as we said. So we start with a short introduction to know which are we here, no, in this meeting and in a former one. Later, the next step is to think one of the two subjects we are going to work about is the scaling. Is it easy to scale? Is it important, no, to think about the scaling of the social innovation projects, if it's a good objective? Later we talk about the other big subject of the meeting of today, that is to talk about the inclusion of the health factor in our programs. If it is pertinent, if it's relevant to think of the status of health of people to work in the employability. So that's the subject, and then we'll talk about the theoretical approach to know how is the situation, the concepts around, and if some data to know if the importance of this mix of health and inclusion. And we'll see later some projects in practice. No? So good practice that we have in the European net. Then we'll talk about the European network, what Alicia was just advancing a little bit, that there is a new approach for the next years. So we'll explain it a little bit in detail. And we'll do later a very short break, and then a dialogue to know how do you look. We'll in those former ones we'll ask you some questions, because as we said, it's a dialogue, so we'll be asking several things through the chat, and we'll know your opinion and your position. But later and after the break, we'll have a group activity to define some aspects of the project we are going to develop, and to know in more details your interest. And then we will close with conclusions, and I could that's the code of colors. We had already a meeting the 17th of May, and I don't want to condition your answers, but what we saw is that the question of working, of how to scale is worthy, is something relevant, and as well this new approach of working with about the health in the social labor programs brings a lot of interest. No? The participants were with big interest, and many of the entities were developing projects or thinking of doing. So it's like a new and interesting mix of two subjects, no? Two approaches. And there were many contributions from the participants at the end in this part that we are going to do today as well, of getting your ideas and proposals about how to develop the project. There were, we counted 94 ideas and proposals from the participants. So it was very interesting, and we hope today, although today is only online, that is sometimes more difficult, we hope to keep the interest and to listen to you and to create something together, no? to get some conclusions.
Thank you, Julian. We would like to hear you, as this is a dialogue. So we want you to feel comfortable to propose and to interrupt us, as we are few people. So feel free to interrupt us with any doubt or comment or whatever. I'm sure you will behave very well. Okay, let's go for the Well, we would like you to we would like to update on the session we already have with the Spanish entities. This is the second session, let's say, but the first was held in the 27th of May. So I would like Irene to talk about a little bit of this session, and also who we are here, what, like the statistics, let's say, or the people participating in this one. So, okay, Irene, please. Thank you.
Thank you, Alicia, and good morning, everyone. Thank you for joining us today. Just to deep a little bit on the information that Julian was introducing about this first session we were having on May 27. This session was in a hybrid format, in person and online, for the Spanish members of the network. And we counted with the representation of 60 entities in total. And most of them, 99% to be more specific, they are very interested in somehow implementing this approach, this nexus of health plus employability to promote the social labor inclusion of vulnerable groups. 53 out of these 60 entities have already an initiative, a project, an innovation ongoing, or are thinking about implementing something related to this topic. Most of them, as you can see in the slide, 38 are considering implementing this approach, but there are 6 entities that are already implementing a big social innovation, and 9 that have a small initiative ongoing. Out of these 60 entities, 29 are already implemented, are interested in piloting or replicating social innovation with this approach, and 37 are very keen to transfer this innovation, small or big, let's say, that they have in the organization. They started to pilot within the entity. In the next slide, you will see some data about the entities that got registered for this session. In total, 28 entities manifested at least some interest when registering to be aware about this topic. And all of us, we can say we are interested somehow in implementing this approach. Also, on behalf of the members of the network that come from other countries, then Spain, and 25 entities out of these 28 have already an ongoing initiative or are considering implementing an initiative with this approach. Indeed, I have been in contact with some of you, and we have exchanged emails in this regard. So I hope this meeting gets your interest and some key information for next steps. And about the entities interested in piloting, replicating an innovative project, the 67% of those entities are very interested. So of you are very interested in doing something with this approach. And the 24% of the people that have registered for this session are thinking or believing that they could transfer or identify an organization that is already implementing an initiative like this. So afterwards, we will explain you how we plan this transferring and replicating of pilots during the laboratories. But I know you got some information already via email, but today is going to be also an opportunity for you to deep on this and to get more information. So that's it so far. Thank you.
Okay, now it's time to explore a little bit about your perception about the difficulty you may feel, or difficulty, or I don't know, or perhaps you find it very easy, or so it's like the perception do you have about scaling up. So we would like you to answer some questions on Teams. No, Irene, are you going to put the questions in the chat? So be alert, okay, to answer through the chat. So it take few minutes. Well, not few minutes, few seconds, I hope. Okay, so Martina, I don't know if you solved the problem with the computer. I hope so. Okay, so Julian, explain us what was the intention with these questions in the meantime.
Yeah, I was waiting to have the question to explain, but I will explain before having the question in the chat. The question is that we thought, no, in Action Against Hunger, that scaling the project is a key point, no, is a key point, and mainly a difficult
No.
moment of the projects.
Sorry, Julian, we have
Yes,
the question in the screen.
Yes, I see. Yes.
Okay.
And then this is our, yes, we have 2 questions already, no? And then this is our idea, no? That scaling is, we decided to work in scaling because we find this a key point in managing the innovation projects, and it's not easy. At least we find like big difficulties, but that's our point of view. And then the first question is, are we working something that is relevant as well for the rest of the organizations of the European network? So we start doing 2 simple questions, but important to know if we are right working on this. No? The first one is, do you think scaling up social innovation projects is important? So this phase of scaling up, of doing as we do a pilot project, it's a small project. We do it in a small area with a small group, it works, and later we want to scale it, to do it bigger and to grow in other geographic areas and with other people, and to have much bigger social impact. That's the scaling. Is that phase important? How do you find it? Very important, quite important. So you have the first question about that you answer. So we have, no, I think, yeah, the answers are there, no? It's not moving. So it looks that we agree, no? That this, we have 100% is very important or quite important. Very important for the 71% of us, no? The ones who are here. So we are working, we are going to work, and we'll explain to you later, in something that we find all of us that is important. No? It was the same answer in the session of the 27. So we agree that it's important to work on this. And the next question is, okay, is something important, no? To manage a social innovation project. Is it easy or is it difficult? That's the next one. What do you think? Very difficult, quite difficult. If you had to scale to expand, to do bigger your pilot projects, your innovative projects, how was it? It's not very difficult for anyone, so I should have both, because for me it's very difficult at least to have one vote there. So, well, it's quite difficult, or somewhat difficult in a way. So it's difficult, maybe it's not extremely difficult, but there are some difficulties to get it. No? So we have something important that is a key aspect of the projects, and is difficult. And then well, someone cannot vote. Very important and quite difficult. We have another vote there. And then it's difficult. Why it's difficult to scale the project? Which are the barriers that we can face when we want to scale our innovative projects? Because if we want to work on this, then we know it's important, we know it's difficult, and then which are the specific questions we work in. And then you have here a list of the barriers we thought they could be there for you to vote. You can vote, I think, here as well, you can vote several of them. So we have several barriers. If you want to add a barrier that is not written here, you can add it in the chat, no? To write what you think.
I think it only allows to answer one.
Okay. So
But in this case, choose the most difficult one, the main barrier for you. For me, there are a lot. There are. We
But
can
if you
mark
want-
several
if-
ones, but
If you want to add any comment or add other ideas, you can write. It's not only to vote. To vote, give us a general idea, but if you want to add some details, just write in the chat and we get it.
okay, yes. In the case you cannot vote, you can as well
Write down.
write it down.
Mhm.
Okay.
So we have, shall I comment? Yes, no, I think it's, well, with the answers we have at the moment, we have, well, the numbers we have an important one, the economic sustainability, that is something that it was as well in the same answer in Spanish session. So we share the same idea. Lack of knowledge of how to do it. That's another one, no? That is voted. That's an important one because we want to work in the methodology to do it easier. Building trust and teamwork with other organizations, because normally to scale you need to have partnerships with others, and that's many times difficult. You underline that one. Lack of commitment from public and private funders. That was in the chat as well, no? Lack of commitment. And twice, so we have really 3 votes in this lack of commitment, because many times the calls are for innovation, but not to scale. No? And the other one, it's not easy to find successful projects to replicate, but that's another one. For that, the European network, I think, would contribute to facilitate to find interesting projects. That's the idea of the work we are going to do the next years. To try to work against these barriers, no? To shrink these barriers, to make them smaller. So, then we have at the moment with this big subject of scaling, we agree that it's important, difficult, and we have identified several barriers that we share. So we start with an agreement, no? At the moment.
Okay, so good start. We have a lot to do. So great, fantastic. And thank you for your contributions. So we will change now towards the challenge we propose during the next 1 year, probably in the network. So, which is the health and inclusion, health in our employability programs, or including the healthy activities or the healthy approach in the employability program. So for that, to put us in context and why we have been choosing this challenge, we have here Sara Tulipani, which is a colleague of us. She's a researcher and on nutrition and well, she's working in the technical engineering department, who is the department, this is a very close department together with us, working very closely. So Sarah will give us the context and the importance of this challenge, so we can have the relevant information about this. So Sarah, thank you for coming and thank you for your time. And do you want to share directly your PowerPoint presentation? Okay, great.
Good morning to everyone. Yeah, I can
Sarah.
share directly. I will. To a moment.
I think it's better for you to advance and.
Let me know which is.
Okay.
Yeah, it's this. Just please confirm me that you can
Perfect.
see the.
No, it disappeared suddenly.
Okay, let's have a look.
So I will just take this moment and check if you can hear me now.
Yeah, we can hear you, Martina.
Hello, I'm so happy.
Finally, you get it.
Hello,
Fantastic.
everyone.
Hello. As Sarah is doing this, just to clarify, maybe it's clear, but the question is we are going to work about the scaling, and what about we are going to scale innovative projects, and the first step is to work about which subject, and then this subject we are going to scale projects in this first time that include the health in the programs, no? So this scaling is the general framework, but we are going to do it in practice about this subject. Okay.
Okay, can you see the slides
Yes.
right now? Okay,
Yes.
thank you very much. Sorry. And so welcome to everybody. I'll try to be brief. So I'm gonna talk, I think, about a number of obvious data about the two-way relationship between unemployment and social exclusion and healthy habits and health. And this relationship is more than recognized, but the extent to which health and healthy habits may be a driver for inclusion and health and employability has not received so much attention so far. So for this reason, we also mentioned some action gaps, opportunities, and keys that since 2018, more or less, in Action Against Hunger Spain, we have prompted to innovate now in this domain. So some conceptual data. Well, since I'm going to show some data from Spain, here are the main national sources of the data that I will show, the graphs that I will show, but I will also broaden the view to a more global level by mentioning some international research. And so this slide is just an introduction to summarizes the situation in Spain, just to simply remind that in general, high-income countries which do not experience war, violence, disaster, conflicts, as poverty and unemployment among the main causes of food insecurity and social exclusion. And specifically, well, we are in Spain, so I cannot mention that unemployment has a very clear impact in Spain, which is the country in the European Union which have the highest unemployment rates, specifically in the south and in the center of the country. But apart from the socioeconomic limitation, it's widely described that the lack of employment also negatively impacts the living habits, the lifestyle of the most vulnerable people, and it determines, for instance, the worse quality of the diet, an increased prevalence of toxic habits like tobacco or alcohol, and also sedentary lifestyles. It's also correlated to greater alteration in nighttime sleep and poor overall rest among the unemployed population, and also they show a reduced access to healthcare and disease prevention. And this situation, bad habits, in turn contributes to social inequality in health, because it is associated with compromised nutritional status, compromised physical and cognitive development in childhood, physical and cognitive deterioration in adults, an increased limitation in the daily life activities in unemployed people more than people which have normal employment. And this make evident the inequalities in health that are for the socioeconomic source, which has a socioeconomic source. And so health is a multidimensional domain, because we have mental health, physical health, social health, and specifically the close relationship between unemployment and poor mental health has been well described, with several mental disorders that has been associated to unemployment, like a higher prevalence of anxiety or stress disorders, but also depression, suicidal behaviors, and low overall life satisfaction. And it's also known that the longer the unemployment period is, and the more relevant are the negative effects on mental health on people, as demonstrated, for instance, by this recent meta-analysis about 29 longitudinal studies carried out in 18 developing countries, different countries. So poorer health status, and so it's less studied the relationship in the other direction. It's also obvious that a poor health status in turn undermines the opportunities to access and to maintain an employment, a job, no? And this is quite obvious, no? Even if it's not so used enough for to innovate in the employability domain. The gender gap also persists in this relationship between unemployment, precariousness, and health, since, for instance, gender norms negatively affects women labor's participation, women full-time employment, and also women's health. And this is the result of a very wide analysis in the world with 97 countries, and in all the policy context studied, gender gaps on employment and health have been observed. But also at the same time, just a positive point, it's also recognized that the women's central role in the family context makes in turn women as transgenerational catalysts for change, so they are the very important target. And this is very important if we consider that several studies, not also national but international studies in different European countries, confirm that low family income and also parental unemployment are associated with poorer lifestyle habits in children and poorer health in children, like with higher rates of disorders like obesity, that it's very a burden in this period. And so some points about now, with all this data in mind, it's almost a paradox that to see that the unemployed and excluded people have not been the priority target for intervention focused on promoting healthy habits and health, even though they are the needy group, the most vulnerable group, also in this context. If we look at the publication in the last 10 years, there has been an exponential increase in studies which have focused on how to promote health and healthy habits of people already employed, and generally at the workplace and for the workplace, because generally the objective, the goal, the final goal is not only improving health and healthy habits of the employees, but generally is how to enhance their job performance and their job efficiency. So this is quite tricky, no? And however, so far, to our knowledge, there are no studies on the promotion of healthy habits, well-being, and health within job search, within employability programs, to focus on the effective, on the most vulnerable groups. And no study, particularly applying a multi-component approach, which means an approach which take care of the physical health, but also of the mental health and the social health. So all this data points to the need to specific action and also innovation. No? First of all, the need to recognize the link between health, employment status, and social exclusion, that is a reality, but needs to be considered in public health policy agendas in order to reduce health inequalities. But there's also the need to recognize access to a healthy life as a necessary level for employability and inclusion, and also to recognize there's a gap and an opportunity for social innovation, in the sense to redesign the employability programs and the job search and insertion program, integrating not only the promotion of professional competencies, but also the promotion of self-care, healthy habits to enhance health, and at the same time also employability. And this is an overview of all the journey that we made since the beginning, when we started with this research hypothesis, how to enhance employability by also enhancing and promoting health and healthy habits. But I will talk about more specifically the program, the employability program after Vidas Empleadas Saludables. And so I will show a bit more this journey that we made in Action Against Hunger Spain. So I think I hope I didn't bore you, but this was more or less what I would like to share with you, and I open to answer to any question.
So do you have any questions for Sarah now? Or we can advance, or?
You can write also in the chat if you have further some questions.
So we can address it later on if you want. So we are going to continue then with the projects about well, no, sorry, I got confused. So now is we are going to launch you some other questions about this challenge we are proposing you. So, okay, we have more questions here for you. You can answer in the chat, Julen.
Yes. As they don't make any questions, we make the questions then. just to explain a little bit the question that you are answered already is to share what was your view. No, we explain our view. Sarah explained very well that all the studies and data that support the idea that, but there is a paradox. No, the common sense. What does the common sense say? No. It has something to do the health status with the employment. It looks like very clear. No? You think in your environment, yes, it's quite obvious that the person it has mental, physical, social health problems, it will have more difficulties. The studies, the data shows the same. But however, on the other hand, it looks that it's innovative to work in this area. So it's like what Sarah said, no? It's a paradox. That's our point of view. So it looks that it has an impact. We are not working too much on that. So as this is our view, these questions, that they are two simple questions, are to know if you share, if we are in the same line, that you find it as well. It has the first one is if you find it has any impact, no, in the employment, the health, and we have a lot of impact, or quite a bit of impact. So I think we agree that the health, the situation of health of a person has a big impact, or at least an impact in his or her capacity to find a good job and to develop a career. No? There is another vote, a lot of impact. So we have, as we did before with scaling, in this case, we have that this idea of introducing the health to work on health and healthy habits in the programs, it could have a big impact. No? That's the first question. And the second one is, okay, this has a big impact. Are we doing everything we can do, or there is a potential in our sector, in the social labor inclusion programs? Do we have a potential to promote health and healthy habits more than what we are doing now in general? I mean, in our social organizations in Europe. We'll wait for the answers. This is like Eurovision, no? Well, at the moment, we have a lot of potential, some potential. So we have something to do, no? According to the answer at the moment. Greece is potential. Yes, that's another question, because the concept potential could be a little bit tricky, because maybe you have a lot to do, but it's difficult to develop it, and then it's like it's a difficult potential. But well, with the answers, at least we see that we could have a big impact working on this mix of health and employment, and we have a potential to do so. Really, as I explained, no, there are not studies or this like there is an important area with a big impact, but no well developed, no, in our organizations. So we see that we agree with this as well. So scaling, to work in scaling is worthy, is something important, relevant, pertinent, and to start scaling projects in this area of health and inclusion looks that is a good idea, because we could improve our impact, and at the same time we have a lot of space to improve and to do things, no? And later we'll see doing what, no? Which ideas can we share to how to start. And then we say that is something that is emerging. Let us see some practical projects, no? that now Alicia will introduce, that how some organizations are innovating in this area.
Okay, so we are going to introduce some projects in this area, as Julian said. So you will have like 5 minutes, please, only to explain a lot of things you have been done in this. So first of all, we will have we are going to hear Milda from Knowledge Code, an organization in Lithuania. And she's going to introduce the project EMER, from emotional management to emotional resilience. So Milda, go ahead. If you want to share your screen directly, or do you want me to share it?
It's okay. I will try to do it. Yes. So please let me know if you can hear me and you can see the slide. Okay. So, well, I'm Milda. I'm working as a project coordinator in Knowledge Code in Lithuania, in the capital, Vilnius. And today I would like to very shortly, I'm a bit worried about the 5 minutes, but I will try to manage. So the project that we had, it's EMER, from emotional management into emotional resilience. So this project happened quite a few years ago. So it started from 2020 till 2022. Of course, we had COVID during that time, so we faced some difficulties, but I think we managed. So if you scan the QR code, you can actually enter the project's website. It's still functioning, and you can find some educational materials there. So we had 5 partners for this project. We were working with the Italians, Spanish partners, Turkish partners, and Latvians. And we developed quite a few educational materials. So first of all, we created some educational videos for 10 modules that we will discuss a little bit later. We also did, of course, a survey research, we got responses from more than 500 adults, and they explained to us what was most important for them, speaking about the emotional intelligence. So of course the main goal of this project was to help unemployed adults and work with their resilience, with improving their self-awareness, with improving their emotional intelligence skills. So in Lithuania, we had actually 4 training sessions conducted, and we worked with adults, but not only just adults. They were older adults. They were living in rural areas. Some of the groups we had specifically unemployed people, people with disabilities, and so on. And what we have created, so yes, the modules, we had educational material, the educational videos, we were talking about emotional awareness, perseverance, locus of control. So it's about either if a person, is taking responsibility for his or her own actions, or he or she is blaming circumstances for what is happening, to him or her. So optimism, of course, support, sense of humor is quite important as well. We found out that in the survey that we conducted, so we created a module for that as well. Certain perspective. Also, we talked about spirituality, empathy, and overcoming stress. So the ways how to do that. And I think, well, looking back at the moment, now that I know the results of this project, I think that one of the most important outcomes, it was this MR card game that we have created. So as you can see probably in the screen, we had created developed actually the game board, the tokens, the dice, the instruction specific games. So we created 5 games related to boosting emotional intelligence skills, and we had printed I think 60 or 80 cards. So you can see it's just the picture. So we took inspiration from Dixit game actually, and we are actually like in 2025, we are still using these cards. So we are leading some workshops and we still use them up to this day. And we get also some, also some calls and some emails. People are still asking like, how can we get the card game? Unfortunately, we had limited funding, so we were printing as much as we can, but we had, I think, 60 sets, and of course we gave them to adult workers, to organizations, to people that were interested. And yeah, we have no physical cards left, but actually it's possible to find them in our project's website and to print them. So if you would like to do that, you're free to do it. And it's really good also for the reflection workshop, like at the end of the workshop or some event, you can use these cards just, for reflection, ask a person to pick a card and to reflect like what was the most important part of the event and so on. But yeah, we use them to work, with adults, but now it has evolved, and yeah, it's still pretty important, I think, in our work. So this gamification aspect, I think, also quite, it was quite important. And actually we got this outstanding project evaluation. So our national agency rated this project 100 points out of 100. So yeah, well, it's like really one of the best practices that we have. And yeah, I think that it helped a lot with working with the people that have less opportunities and, a little bit more complex groups such as unemployed people or those who lack, confidence. So we were working with this material, and I think we reached quite good results. So yeah, so if you have any questions, you can let me know, write in the comments, or ask straight ahead. So yeah, and it was strategic partnership project. So actually K Action 2 So not scaling, but I think the idea could be used also. Something similar could really, get the funding.
Yeah. Okay, thank you, Milda. Milda is project manager and educator. I forgot to say that. So we will go to Martina Rango, head of the short break and personal assistance program at Fundación Imago. Well, sorry, I said it in Spanish. Imago Foundation. So she's going to talk about to tell us about the Building Better Breaks Together project, which is a respite care provision for persons with disabilities and their cares. So, Martina, do you want to share your screen directly? Okay. 5 minutes. Sorry to say.
Do you have my presentation maybe? Because I've got I don't know what's happening. I cannot show it now.
Yes, I have it opened. I can share it for you.
Okay. Thank you.
You just tell me to press the slides.
Okay, thank you. Thank you very much. So my name is Martina Rangno, and I have a pleasure to lead a short break personal assistance programs at Imago Foundation. We are based in Poland. And maybe let me begin by introducing our foundation a little bit. Can I have a next slide, please? So we are like non-governmental organization set up in 2009, and we mainly cover our activities through projects and already completed over 150 of them. So right now we are like quite big organization because we've got 25 full-time staff, and we are cooperating with more than 200 personal assistants right now. We've got 4 offices in 2 regions of Poland, and our head office is in Wrocław, where I am right now. So if it's going about what we do, one of our main pillars of the things we are creating is personal assistance and respite care programs, which we are running since 2014, and every year we are supporting around 400 clients. So our activities focus on mainly like 2 areas. Can I have the next slide, please? So the first one is personal assistance for the persons with disabilities. So we started with those programs, which were like the implementation of the rights to independent living in Poland. We didn't have the access to those kind of programs before, but we started to focus on like supporting persons with disabilities. What is important, we do it like in the community. So we are not like having the center where people are coming to visit us. We are like going to the place of residence of our clients. So I will tell about the process a little bit more in a few minutes. So we've got like community-based support. It's super important for us. We are trying to have like very individual support, like tailored for the needs of like every single person who is coming to the foundation for the support. So we are doing like the diagnosis, and we are trying to match like the needs of the people who are like coming to our foundation and choose like the best possible support for them. We are like one of the main pillars as well is flexibility. So we are trying to hire like personal assistants who are like living nearby, not to like have to waste time for staying in traffic to reach the person who they support. We are trying to be flexible if it's going about the number of hours we are giving to our participants. We are trying to be flexible if it's going about the daytime they're like using the services. And we put a lot of efforts to build the relationships with our personal assistants and clients. So we are very visible in the local societies. We are very visible like in the houses and around like the places where we can meet like persons with the disabilities, and we are like very in contact with them through the whole process. But at some point, like we discussed, because our foundation
Sorry,
operates
Martina. Sorry,
Yes?
if you want 2 minutes more,
Okay.
please, because
So
we
the next,
are running
okay,
out
okay,
of
okay,
time.
okay.
2 or 3.
So next slide, please, then. Okay, 2 minutes. So like we often are the first people who are approaching the caregivers as well. And we are like asking them about their needs rather than focusing mainly on the needs of the people they're caring, taking care for. So we started the programs of short break and respite care as well. So they're basically supports caregivers from providing long-term care to dependent persons. So we are trying to ensure them time for themselves, increasing opportunities to take up or maintain employment, which is super important. We try to have diverse approaches to respite care. So we've got like daytime and 24-hour support. And we started to scale it also for the short break trips, which are like the active respite experiences, which are like one of the main pillars of our activities right now too. Next slide, please, then. So what do we do and how do we do it? Like the main thing, the most important for us is like to do like good diagnosis. We've got like own diagnosis tools to access the individual needs of our clients. Then we have like very good staff recruitment. So we've got like psychological assessments, evaluation, training for the assistants. Then we are matching the participants with the assistants. Then we are like delivering the service. So we've got like very flexible support with the substitution system. And then we are like have quality control, monitoring the things in environment because we want to increase the focus on quality care. And the last slide, please. Where like it led us responding to the needs of our clients, we decided like to increase like the accessibility of their surroundings. So we do like audit, and we use people who are like using our services, so persons with disabilities, to be like the experts by experience. So we are taking them to different places and let them talk about like their needs and how they see like the accessible surroundings around them. Then we started the adventure therapy, which is like connected to accessible tourism and sports. We've got therapeutic climbing wall, summer camps, nature expeditions. Then we collaborate with a lot of local governments because we are developing the services in smaller towns, rural districts, improving access to the services in those areas as well, which is strengthening small local labor markets because we are providing the trainings and employment for the people in smaller markets. Sometimes it leads also to professional activity or caregivers, because sometimes they're like also like the moms or like the children of persons with disabilities coming to work with us to share their experiences and take care of other people as well. Plus, it led us also to international cooperation So we are still developing new tools, implementing foreign solutions. It's very brief right now, but yeah, thank you.
Thank you to be brief.
Yeah.
Okay. Thank you, Martina.
Thank you very much.
Thank you. Well, we are going to continue with Alexis Kotsis from Organization Earth. He is the environmental project manager, and he's going to tell us about the sports and environment program they have at the Organization Earth. So, Alexis, do you share your screen? Yeah.
Let me know if this works. Can you see it?
Yeah, we see the last slide. You are making a spoiler, a proper spoiler.
It's okay. It is fine. It is fine. So first of all, my name is Alexis Yanarakis. I work as a project manager in organization Earth. We are an NGO founded like 15 years ago. The objective then was to provide knowledge to civilians, to the people living in an urban environment on how they can cultivate, grow, and eat better quality food in the city. However, give me a second because I see that. Okay, let me know if is it like a presentation now?
Yes.
Okay. So back then, the main objective was this: how to teach people how to grow healthier organic food in an urban environment. The refugee crisis came, and the objective changed. So we had to target this issue and the populations that were arriving by boat to Piraeus. So this created another anchor for Organization Earth, where basically we deal also with social issues. That was then done with community cooking. So basically we invited volunteers to join us in the port, where we cooked as much food as we could to provide for the people back then. Over the years now, this has evolved into two pillars, basically. We do have the environmental pillar and then the social pillar. Of course, these two interconnect, as we all know. We do most of our programs in our organic garden called the Center of the Earth, where we use the organic garden to teach people by doing workshops, experiential workshops, as we call them. So as we cultivate, as we grow food, we learn about environmental issues at the same time, how they connect with climate change, how they connect with social issues, etc. Now, how does this connect with, let's say, vulnerable groups and health? Of course, as it was mentioned beforehand, basically it is the environment is connected with social issues, right? And vulnerable people, only by participating in activities such as this, do gain, let's say, better skills, soft skills such as management. They gain confidence, and you can teach them how to make their everyday lives better, as well, of course, as socialize. So when we talk about vulnerable groups, many times they're socially excluded, and we try to counteract that by not only providing a space for them to basically socialize and network and do let's say do learning activities that they wouldn't have the opportunity to do beforehand, but also to connect them with other groups that they would not normally connect with in their own activities. So basically, let's say we work with groups with intellectual disabilities, we will have at the same time maybe an activity with another group that, let's say, refugees or migrants, and we try to mix them. Or we will have an activity with farmers and then school children, etc. So we try to mix these different kinds of target groups in order to, let's say, let them expand their network. Second, let me go to the next slide. So these activities have evolved. As we said beforehand, it is hard to create long-lasting actions without what that was my opinion, let's say, but it is hard to create long-lasting actions without the involvement, let's say, of local governmental bodies. So we try to collaborate with municipalities in order to, let's say, take a public space and upgrade it into a greener and more inclusive space. So we call them pocket parks. And basically, we take unused areas and let's say unsafe areas or areas that are viewed as unsafe, maybe because they are abandoned, because they are dark, because they are degraded, and we try with in collaboration with the municipality to upgrade them into a place where people want to attend. We organize activities there. We invite other groups to do their own activities, etc. So involving municipalities is the main way to basically make it sustainable, because in our case, let's say we get some European funding in order to do a project, and we can do that, but at some point that will end. So we will not be able to support it anymore, let's say after 2 years. So we need someone, and of course there's no one better than the municipality to make sure that this will be continued. Now, talking about vulnerable social groups, as I said before, in terms of environmental learning, the way we tackle, let's say, because we invite, let's say, people from all backgrounds, we do workshops for children, we'll do workshops for the elderly, we do workshops for people with intellectual disabilities, and how we do this is basically we cater the educational material or the educational purposes of the workshop to the background of the target group or the age of the target group. So we will make easy to read guides. Let's say if you have a community cooking event, we will prepare easy to read or easy to execute recipes for people with intellectual disabilities so that they can easily understand it and take it back home and replicate it themselves. At the same time, for the elderly, we will try to provide, because I mean, in several occasions, they will have more knowledge than us in certain matters because maybe they have dealt with it more or dealt with the traditionality, let's say, of farming. But at the same time, we can offer them a space and an activity so they can socialize and feel empowered. In terms of sports, we work mainly with refugees and migrants, where basically we try to promote team building, we try to promote confidence through teamwork in sports, but at the same time it does not leave there. We try to take the let's say the children, the unaccompanied children, out of the camps and bring them maybe to our offices here in downtown Athens, where they can have, let's say, an external activity not related to sports that is maybe something that they have not encountered before. That could be let's say a workshop on.
Sorry, Alex, 1 minute.
Yes. Of course, a workshop in some kind of science, or let's say 3D printing, or maybe basically show them things that they do not have the opportunity to see while inside the camp, of course, so they can have an idea of what they would like to do growing up. Now, many of these, I mean, most of these people, it is hard to provide something substantial because, of course, most of these people do not want to stay here. But in any case, you want to include them socially, and of course empower them and basically again improve their network, connect them with people. At this point, we also have. I want to say thank you, of course, to Alicia, Irene, and Action Against Hunger in general for inviting us. We do collaborate in other projects that deal with vulnerable groups. Thank you very much for the opportunity. These are some of the pictures from inside the cast, from some of the empowering activities that we do. Thank you. Thank you very much.
Thank you, Alex. Thank you. Okay, so it's the last one, the last project we are going to show you. This is, so stay tuned to this one because we will focus on it in the transferring process. So we have again Sara Tulipani introducing this project. We are developing in Spain since several years ago, which is Vives Emplea Saludable Healthy Employment Program. Okay, so Sara, if you want to start, thank you. Also, very briefly.
Yeah, for sure. Can you see the slide?
Yeah. Yes.
Yeah. Okay. So very briefly, we will be talking about the employment shuttle Vives Emplea Saludable. What is it? It's an employment shuttle with the focus on health and food security. It's a program for free at the unemployed people in situation of risk of socioeconomic vulnerability, which in addition to train the traditional, contents of an employability program to train personal skills, professional competencies to access a job. It also promotes the acquisition and improvement of healthy habits. And this aims to provide a beneficial impact on health, well-being, and employment of the participants, but also to provide an added value to the family to have a more wider impact, and also to the companies of which they end up being a part. How does this employment shuttle work? This is a bit the project cycle. The duration is more or less 6 months, and it's divided into 3 phases. The first phase is the diffusion, recruitment, and selection phase, about 1 month. And during this phase, we have we have to use all the possible dissemination channel to have the visibility through various activities and to publicize the project, and to let us know and to get a reference entity for the employability in the territory. There are 4 main dissemination channels: the institutional collaborator entities like the city councils. We also have the help of the social services and employment services, other social entities, for instance, also the health centers are a center where we can have some visibility because people at risk of socioeconomic exclusion and with health issues can know at the health centers about this program, and also the general public with all the social media, the local media poster, and other way. And during this phase, so we recruit the people, and then there's the selection, and the selection criteria are mainly that people should be unemployed, between 18 and 65 years old, be in a specific vulnerable situation, one among all these criteria: long-term unemployment, people living in households where all the other members are unemployed, migrants, victims of violence, or to have some degree of disability, homeless people, former drug addicts, and former prisoners, and so on. Of course, they should be available to participate and should be able and motivated to work in team, because there's a lot of work team in the program. And after, there are the 4 months duration of the whole program, that is in a mixed format, online and also in presence. There are heterogeneous groups, or 25-30 persons, and 2 editions per year. And the innovative part is that, together with the traditional content that has an employability program, such as employability group sessions, ICT skills sessions, external events like the participation to job fairs, individual session for more personalized support. There are also 4 types of innovative activities that are specific to improve healthy habits and health, like thematic workshop on healthy habits carried out by field experts in nutrition, physical activity, sleep, and also disease prevention and emotional management and self-care. After there are group physical activity sessions by performing 30 minutes of physical activity at the end of each session through direct personal training, which try to adapt the content of the session to all the participants, the possibility and the needs of the participants. Then we also share LTPs, which are brief reminders taught directly by the project techniques themselves. And then the funny part, that are the healthy messages that are recorded like funny messages with a lot of sense of humor, just to fix the content, but in another way, not so, serious. And after this part, there's the closing part, the last months of the closing activities, with a lot of, closing activities, but we also, and particularly, monitor and evaluate the impact of the program, both in terms of job placements, of course, but also in improvement of habits and health. And generally, we also monitor 6 months after the end of the program. And also we measure and we evaluate the satisfaction of the participants. And sorry, I had no time to translate all the messages here, but at this point we can boast that of having a very high satisfaction level about the general program, and also specifically on the integration of the cross-cutting health component into the traditional itinerary. That is quite a surprise, because at the beginning we were thinking about maybe it's not so clear, the relationship, but participants understand perfectly and really appreciate this combination. And this is very quickly the evolution, the timeline with the evolution of the program since the beginning. In 2013, we launched our first employability program in Spain. Then between 2018 and 2020, we were carrying out first context analysis to define also a prototype of employability program with the LT component. And here we were making a socio-ecological analysis of the San Cristobal neighborhood, where we were implementing the employability programs. And we chose the San Cristobal neighborhood because it's one of the poorest neighborhood in the capital with the highest unemployment rates. And we were comparing the condition and also the healthy habits and the health perception of our participants and the population with very similar socioeconomic conditions. And almost at the same time, we also published a first kind of position paper about the unemployment, precariousness, and nutrition and health in Spain in crisis at this moment. And this was the basis to have the first public funding to carry out the first research action project from 2021 to 2023 to assess the effectiveness of the LT employment shuttle that integrates this component to the normal, the traditional employability itinerary. And right now we are with the second public fundings specific on this program. And we are finalizing a social innovation project funded by the Community of Madrid under the European Union Next Generations funds, in which we are also studying the effects of combining employability and health promotion on the food security of people at risk of extreme poverty or moderate poverty. So I hope I respect the time.
Yeah.
More or less it was the summary, and thank you so much.
Okay, so we launch a quick question now for you. My colleagues will launch it now very quickly. Okay. Julian, explain.
Yes, I try to explain. Yes, we saw several very interesting projects no? They are a sample of the innovative projects that we are developing in the European network. And then the ideas, as we explain a little bit, and we are going to explain a little bit further, is to work on some of these projects to replicate them, to take this innovation from and I will explain it better, from software, and then to scale it in a different place. And then you are participating in this meeting, and then we'd like to know, these are just samples of well, yes, they are very important samples, no? of innovative projects. There could be different ones, but with this framework of scaling projects in this area of mixing health and employability, are you interested in participating? Because maybe you are in the meeting just to learn a little bit, but you are not interested, or your organization is not interested in participating somehow, or transferring your projects or replicating an innovation of another country in your organization. So the question is, with this context that we gave you, do you have a priori interest in participating? It is not a commitment. It's to know, no? If among the ones who are in the meeting, if you have interest. So one of these days, the question will come to the chat.
No,
for you to.
Do you see it? Do you see the question? The question
yes,
is already launched.
Yeah. I was with the chat. Better.
Okay.
It was not ready. Okay. I was like explaining, waiting for the question to be there. I was not seeing it.
Okay.
I was lost in the desert.
So a lot of interest.
So
for
we have
answers
interest. Yes.
But a bit of interest to answers. Okay.
So then we explain now how we're going to do it. Alicia,
exactly. I'm going to, well, Julie and me, we are going. Where is my, here. Okay, so we are going to explain you like, well, the new approach, sorry for the Spanish. Here, well, the new approach is, we are coming from somehow these terms, no? Exchange of experiences, participation in European projects, looking for best practices, and we conclude that all this participation in the European network in the previous version, and always the participation is having an end, no? Is like finishing, and after the exchanging, and that's all, no? In most of the cases. So we transform this towards promoting or having social innovation workspaces to work together. And if we are not going to work together, learning together or observing the process or whatever, so we will move towards social innovation processes all the time and terms. We are going to consider EU projects and EU funding opportunities as social innovation opportunities and social innovation instruments. We will be speaking about social innovations always, not best practices, neither good practices. Our projects even, we are looking for social innovations with, measuring the impact of these social innovations. And then we will work also towards the sustainability of the projects with the concept of social experimentation. We are going to have these spaces, and we are going to try to make it sustainable and through this scaling up process. This is a very overview of the network now. We are 568 entities from 34 countries. We don't have time to explore this a little bit. We have been increasing the members through the years, and we have a very good representation in all the EU countries, but mostly in Spain. And, well, I let Julian to explain you how we are going to work in the systematization of the scaling process. Okay.
The first thing is to change the word systematization.
Yeah,
it's
very difficult to
very
pronounce. A challenge every day. In English, even mostly.
So I will do it very briefly. The question is, well, I will have to be jumping, Irene. Okay, I will tell you. As we explained, we have this is a methodology we have to manage the social innovation projects. And once we arrive to the scaling phase, we fall in. Come on, Irene, come back.
It's Alicia.
It's you. Sorry. So what happens is called in innovation the valley of death, no? Because many pilot projects and experimentations, once they have to grow, they don't get the funds, they cannot continue, and they stop. No? It happens many times. At least, well, it's a general and a very common known problem that innovations die many times once they have to grow. No? So what we are going to do to systematize the process is to analyze. We are going to do it in practice. We are not going to do just a methodology on the air, no, without any connection with the reality. But we are going to be working with some entities in this replication process, no, to scale the project, and then we are going to give their click. Alicia?
Oh, sorry.
Yes. We are going to analyze all the factors that they are in the organization that is transferring its context and the characteristics of the organization that is receiving and replicating the project and its context. No? And in this process, we'll analyze which things we have to manage in a way, which things are barriers, and how to adapt the project to a new organization with different profile and a new context. No? So we'll work with these organizations, scaling the process, and at the same time, in parallel, we'll elaborate the methodology and the systematization. So please, next. And if some here, yes, I will explain the end. There are different ways of scaling. No? You could scale with the same participants or new participants and in the same region or new region. No? And as well, at the same time, you can participate, give a click. Yes. Inside your own organization, that it could be intra-entity, no, inside the entity, or between the different organizations. Then we are going to work among all these options. We are going to work mainly in the geographical replication between different organizations. This is the focus we are going to have to systematize the process, no? The scaling process.
Yes, we are going to focus on the geographical replication in the framework of the network and this practice, but we are going to also work on some working documents to make this scaling intra-entity in your entity.
Yes, because it's very common, no? And really there are many common issues between the two processes, and in many cases the organization could be more interested in scaling the innovation on their own, no? Inside the organization.
Inside the organization. So,
and then
yeah, Julian, sorry.
Yes, no, if you want, it's the same, because they did the same.
Yeah,
we are going. Yes. I can give all of it to have a look.
Okay.
Yes, to do it briefly, it's easier like this. And then what we are going to do, we are now in these listening sessions, no? as we are today, and the objective is to identify innovation, that is that orange circle in a Spanish organization, interesting innovative project to scale in this area of health and employability, and then to replicate that project in 2 other organizations in the rest of Europe. And in the other sense, we are going to identify interesting in innovation in an organization that is in the rest of Europe, to bring it to Spain and replicate it in 3 organizations, 2 entities, and Action Against Hunger is going to make the exercise of replicating as well, because it will help to learn about the process, to deep the process, and to understand it better. So this is the nuclear, the heart of the project, that we start with this area of health and employability, and later we'll work with other challenges. So the next one, this is just move all of them, because as we explained, we are going to work. Go to the next one. In this area, it includes inclusion, health, and employment. In this specific area that we explained already. And what we will do, go to the next, please, Alicia. Is this? Yes, I put the whole of it to do it faster, and then we'll analyze the innovations to replicate, and we'll take into account 2 vectors. If that innovation is attractive, if it generates a good impact, is innovative, if it's an attractive innovation, and at the same time, if it's easy or difficult to replicate. And then we'll try to focus in those projects which are attractive and at the same time are easy to, or at least not very difficult to replicate, and to start with interesting projects that we could manage. That's the idea for this first step. And then, I think it's that, no? Yes.
Exactly. And now we foresee a break, but we are running a little bit of running out of time. So if you agree, we are going to continue. And if you want to go to the toilet, you can go, of course. So we continue with we want you to speak a little bit. What are your impressions, your feelings, and we are going to ask you some questions, or we are going to explore with you together. Well, this is the time for questions as well, about the process, about what we are proposing to do in the network in the next cycle. So, Julen, your turn again.
But are we going to have a rest or no? Because I continue, Because
we can continue, I think. No?
Okay. Yes, because with the time, yes. Okay. So the question now is to be concrete, and then, as we explained, we saw the different innovations, the process we are going to follow. Now let us try to be concrete a bit, and among the ones we are here, let us try to go a step further to know how to participate each one of us, who is interested. And the first thing is the idea of replicate. We saw some innovations. They could be these ones. One of the focus one is the Spanish one that we saw, the Action Against Hunger. And then in general, with these projects we introduced, we presented, are you interested in being a replicant entity? So to bring that those innovations, one of them in your organizations, at least to explore that possibility. That's the first question.
You can answer in the chat, or even
yes,
raise
you can.
hand.
Yeah. So now is to know, we have to continue going to this identification of the innovations and the organizations who are going to replicate those innovations, and then let us try to identify now to continue talking with who, what about. Yeah?
Mm-hmm. So
And
the
it's-
second
it's-
question, no?
Mhm.
So who would like to get the information of a successful Spanish social innovation? So that's more or less the same question, but
Yes, it's to explain the first one, yes. No, but
well, I would ask about the third question in the screen. What would you ask to the transferring entity, the innovative project, and the European network of innovation for inclusion to be able to replicate it properly? So what are the main barriers you are facing? So if you can imagine that Vives Emplea Saludable is going to be transferred to the organization, what would you ask to the European network, and what would you ask to the entity who is well, in this case, it's our innovation. So what would you be asking us to provide you? What kind of support? What kind of monitoring? So we would like you to explain yourself about this. Sorry, I cannot see you because I have the PowerPoint.
so I will explain the question again to try to, if you have to start replicating a project, let us think of the to replicate the project of Action Against Hunger, just to be specific.
Mm-hmm.
What do you need to start? You have to organize the process. How would you like to start the process? Visiting Action Against Hunger, getting information, having a meeting, analyzing the differences between the context you are working with, maybe with different groups. How would you like to start? Which kind of support you would like to have?
Do we have to answer the questions now? Can we speak?
Yes.
Yes, you can speak
Yes.
freely.
I'm sorry.
And
I
thank
got
you,
to be-
Alberto, to come
Yeah,
in.
We are begging for you to answer now.
No, it's okay. I'm sorry, I've got a bit of a cold, but I'm trying. I'm Alberto Pirola from Azione contro la Fame Italia.
Mhm.
And our interest is more like scaling up intra-entity, because we are already approaching the joining in our activities, the the social labor inclusion and health health thematics. In fact, our project is starting from Vives and Emplea, no? Is like a branch of it. We didn't copy; it was exported there. And now we got four locations for our classes in two cities, Milano and Milan and Naples. But now it's time for scale up the project, find new places where to implement this format, because we found it really interesting. It helps people. That's the real interest, no?
Yeah.
It helps people to integrate. It helps social inclusion, and it helps also people starting not just from the jobs to find a job, but to find motivation and also self-esteem to refine their place in the society, starting from their well-being, no? Sorry, my English is not the best, but I'm trying to to explain
perfect,
myself
yeah.
as the best.
Like mine and all of us, I think.
Yeah, but I'm not used to speaking English through the screen in these situations, but it's okay. But what we're looking for, it's find a way to be sustainability, because it's really difficult to find location, open classes. For example, you don't have just to find the space, you have to find the partners on the territory.
Mhm.
You have to promote in the new territory the format, the model, the project. For us, the problem is to find a way to expand in Italy, of course,
Mhm.
to scale up the social impact. Can I say
Mhm.
that? And I don't remember the questions. I just wanted to explain this.
No, but you answer. Even if you didn't remember the question, you answer very well.
But I think it's really working, this thing. For us, the healthy part is in the project, not probably like in Spain, but we promote education, emotional education. We have a nutritionist with workshops and also an individual moment. So it really helps. Also, to the other people are listening. It's something I believe in. So I'm here also because I'm interested in everything of this. So,
Just to answer, to complement what you are saying, I found it very interesting because we are asking what do you need to replicate the project? And one of the things you said, at least as I understood, is that okay, the project, you try it, the project, to test it, you like it, but one of the key questions, key factors of this project is the partnerships, with the institutions. And then to replicate the project, you don't need just to know the project, the methodology, how are the sessions with the participants. You need all the network around the project to be able to build it, to get the funds, but as well to get the space, to build the partnerships, to convince the institutions to start with this new approach. So you are asking that to replicate the project, you need much more than just the description of the project. No, you need to know all around that makes the project possible. Well, I understood like that your question, no? Or your answer.
Yeah, well, in this case, so you already have the support of Action Against Hunger Spain, so in this approach, so you are an advanced student in this case, I think. Because
and I think
yeah.
no,
Yeah, but now that you are like more worried about the scaling in your own country, not transferring between entities, so you already have the social innovation inside, and the scale intra-entity, as you say. That is a good process. It's a difficult process as well, and we understand that all the entities have the need of making this happening, to scale it up, but it's a different process. We are going to focus on it as well, but we are going to explore like different experiences, and our own experience as well. So we will put so you will be an example in that case. Well, but in the inter, not in the intra, and we have experiences as well. So
Yes, a little bit in the middle because it's intra, but it's in an organization in another
it's
country.
true. Now it's inter.
The context is different. It's intra-inter, but what he explained, I think is applicable to any other organization who wants to replicate the project. No, because hey, I have the project, I tried, I like it, but now how can I get the partners to? How did you do it in Spain to get the partners to go all around the country? And so that it could happen to Alberto in Action Against Hunger in Italy, but it could happen to any other organization in Poland or in other country to replicate the project. So really, as we are saying, what do you need? They need not just the project itself, they need the project and all around the project to do it possible, to understand all that and how to get it in their context. So I think for a scaling process, it is very interesting what he said, because we tried the project, but now to do it bigger, he needs that key factor of the partnerships.
Yeah, I can only add from my end that from my experience, always like taking part in like the study visits and organizing international trainings, also extending the visibility of the solutions and project in our own countries as well. Because like even if you're organizing, let's say, a study visit and you're inviting the guests from abroad, but also like your local governments, like, let's say, or other organizations who are working around your field, it's always helping to increase the visibility of the project and the things you're doing. So yeah, just
yes. But in the feasibility of a project, there is much more than the description of the project. No? We don't realize that we say, "Now we work with this group," and later you want to do it in a different organization, and you need more pieces of to build it. No.
I can launch some more questions, Julian,
Yes,
about
I
this,
think
or
that
we can advance
I think we can. Yes, we can see as we have the 10 minutes. We can see the other side. No? As we have here several European organizations with an innovative projects. The other question is to be now in the other role of the transferring organization, and you are going to transfer what would you expect? How would you? What do you expect of the organization that is going to replicate your project in this country? Which are the requirements you think if our organization is going to do it in a country? What would I ask to that organization? Would I give? What would I like to get from this process? Because maybe it's not just a question that I transfer, I get the information. What shall I get? What do I want as well? No? Do I want a learning process as I am scaling the project? So to go a little bit deeper on that in this other role of transferring organization. What would you ask to the European network to be supported in this process as transferring organization? This is good because they don't need anything.
Would you be interested in transfer your project, your social innovation? First, do you consider that your project is a social innovation? First. Second, would you be able to transfer it to other organizations, or what? Would you have any barrier to do that internally at your organization level? I mean, your organization is open to transfer your social innovation? You can say yes, no. Simple.
yeah,
I'm making it simple.
No, but yes, you did very much better questions. Mine was like too complex. I think
for Poland,
yes.
for sure, like we would be interested. For me, it's hard to imagine right now, like the structure of it, like how like it's gonna look like. But for sure, we've got like a lot of things to share. If it's going about tools or experience or like the process of organizing the whole process and starting the new projects, like and scaling them across the like our country, but also abroad. And for sure, we would like to learn something from other organizations and implement the solutions in our country. But it's very hard to answer like super specific right now because you're asking very specific questions, and I think like the questions will come through the process, like during the process.
Yeah, sorry.
Well, but it could be, how do you look at it now? No, to the idea. If you, I find like an attractive idea, I think we could go further in this way. It's not, as I try to say, it's not a commitment. We are going to start tomorrow, but it looks interesting. From my point of view, for instance, if you scale your project, you transfer your project, it's a very interesting learning process for you as well. And I find it interesting, no? As
Yeah, well, if I say that you will have like financial support for both roles, transferring something or importing something, would you be more happier or not?
I think it's always like the question about time, if we've got time, if we've got staff, and if we got enough money to do everything we want. It's always about those three things, actually.
Well,
Because engagement and will is always there, but
Yeah, because well, these questions we make it to ourselves, no, in the process of writing the project. So it's clear that you will need more guidance on this, no. So it's okay. The European Network is going to guide you through this process, and will like advance some work and some searching for innovations and trying to make it more smoothly and to easy the process. And it's clear that we have been seeing during these years and that the time of the people is also a barrier to work on the social innovation, no, internally. And that's why we are going to support you in this sense, no, and giving you time through staff time, mainly. And well, we will launch a call for both, for transferring entities and receiving entities. I don't remember the name, how we call it, replicant entities. Replicants and transferring. So we have in mind one design, but we would like you to speak about this a little bit in the session. But it's okay if you don't have the idea and nothing comes to your mind, because we have some ideas in our minds and plans. But we would like you to give we would like give you to the opportunity to explain us like something, if you find something more difficult or something like that, no, and to explore a little bit your feelings, as I mentioned in the beginning of the session.
Alicia, Eleonora, that I don't see her now, was raising, was asking for.
Okay, because I don't see you. I don't see you. Sorry.
Yes,
she was asking a lot of 1 hour ago.
Oh, sorry.
Good morning, all. Thank you very much. I'm Eleonora from Matera Hub from Italy. Sometimes we feel like we are out of social inclusion and innovation because we are more focused on the creative and cultural sectors, but is very related, and especially in our project we manage in the craft sector. We experience how this sector could be a very good sector, both for the employability and social inclusion. And we are open, of course, to share our project and experience within the members of the networks. But I believe scaling up is also related to the lesson learned. So concerning what you are asking this morning, I believe could be very interesting, not properly to replicate a project, but to share, I think now, for example, a successful project in Spain, to share the knowledge, the methodologies, and the experience, both the challenges and the tricks, the problems they face in their experience, because scaling up is doing something new based on what you learned in your experience.
Thank you, Leonora. I'm happy to see you.
Eleonora answered the last question, but we didn't do it. But she's advanced because we we wanted the last question, no? Which other kind of participation could we do? No, this is the one transferring we did, but we have this last one, that other possible roles, no, entities that maybe you don't replicate because there will be a few replications you do transfer, but you would like to be aware of the process to learn, no, to what you Eleonora explained very well. Yes, to find the trick of the successful projects, or to see the problems that the ones who fail faced, and so this idea that we were thinking of, we have 7 organizations who are transferring or replicating. This is a part of it, but other organizations around, I think, would like to learn from the process, maybe without replicating the whole project, but maybe acquiring, learning some methodologies and some interesting approaches that they can adapt to the reality. Is I think what she said, and I think it could be very interesting if we organize this in such a way that it is an open learning process for and extended for many organizations of the European network.
Well, it's 12 o'clock. I think we can go to the next steps. Okay, so we are going to, well, I can explain you very briefly in 1 minute. We are going to work on the conclusions of both dialogues and make our own conclusions to move forward in the process in the European network. We are going to make also micro training pills in the topics on process of social innovation and project scaling. So we will have these training sessions. So we are going to prepare some spaces also to networking. So we are going to work on this during this year, and some of them, well, we are going to try to do it in presence, but also e-learning. So we should work a lot in during this half of the year, the next half of the year. And we are going, well, the most important, I think, is we are going to be launching a call by September, I think. This call about calling for replicating entities or transferring entities. So you will know about this, and so in that call we will explain the financing opportunities of participating directly, these 7 entities only. But we are going to explore and to propose you some other participation ways to be in also part in the process as observers, or being, I don't know, evaluating the process or contributing somehow. So this is all from our side. So thank you for your time here, for joining us. It's happy to see that you are interested in our activities. We are trying to provide the best of our services to the network in order you can innovate and continue your social innovation processes. So and we ask you to fill this brief survey. You can Irene share it in the chat as well. So we are going to ask you also in this questionnaire about the role you may have or you can have in the future. So that's all. It's time to continue with our duties. And thank you all, and we keep in touch. And please fill the survey.